see the appendix going in here. So this appendix is less than or around 5 millimeter in diameter. So let's see, from serosa to serosa, it is 4.3. So this is normal. I can make it bigger for you so that you can see the luminal line. There you see the white luminal line of the appendix. So the lumen is empty. The two opposing mucosal surfaces together will make this white line. On both sides is the mucosa. On, on either side, you see this submucosa, the white. Then is the proper muscle layer, muscularis propria, and then is the serosa, the white. So how many white are there? The luminar surface is white, the submucosa is white, the serosa is white. This is muscularis propria, and this black is the mucosa and the muscularis mucosae. So 5 layers on this side, 5 layers on this side. This is how we see a normal appendix. There we are. So why are we here now? We wanted to see any fluid in this triangle where we have seen. This triangle is made up of this iliopsoas muscle, this is the iliopsoas muscle, black, and the central aponeurosis here. This is iliopsoas muscle. This is anterior abdominal wall. And this corner in which you can see movement of the gut and mesentery. सांस लें. There you see this triangle. In this corner, one side is gut, anteriorly is the abdominal wall, posteriorly is the muscle, iliopsoas, any free fluid in the right iliac fossa, which we quite frequently see, will be seen here, where you have seen this appendix. And then on the left side, the same. And there you see the iliopsoas muscle. Now you can actually see some fluid, this triangle. So you see, asymptomatic, 100% asymptomatic. This is free fluid, this black. There you see. This triangle is free fluid. Now you can appreciate better. And you can see gut loop floating inside. There you see the gut. This is not a blood vessel. Blood vessels are away, far away. There it is. This is free fluid. All right. So we have seen the anterior abdominal wall, the iliac fossa. We are now going over to the convex probe again. We will see the abdominal organs and then the pelvis. I must tell you that idea behind is to look for a finding, an asymptomatic finding in an individual who is otherwise absolutely considering himself healthy and is not having any complaints whatsoever. So now we are going to start with the abdominal workup. What are we going to see? We place the probe here in the epigastrium and we tilt leftwards to start with. This is important. I'm tilting leftwards to see the left side of the left hepatic lobe. I have noticed there is food in the stomach here. I can see the crust of the diaphragm there. This is the aorta, and this black is the crust of the diaphragm, the muscular part. Lamba सांस लें, रोक लें. And there you see the esophagus. This one, this rounded, this is esophagus. And there you see the stomach with food. And this region is the pyloric region. This region is the pyloric region. So I have seen the liver longitudinally. I'm moving towards the right. I can see the portal vein and I can see the bile duct. Now, once again, लंबा सांस लें, रोकें. There you see the portal vein, the bile duct, and the hepatic artery in between. There it is, the hepatic duct, the bile duct, the portal vein, the hepatic artery. Can always put color. So the portal vein, the bile duct, the hepatic duct, the common bile duct, and this small is the artery. There you see flow in the artery there, this one. This is it. The duct remains black as there is no flow in the duct. Yeah. So I am moving to the right. Now, after reaching the costochondral margin, I will place the probe here where I did earlier in the intercostal space, 10 o'clock position. I can see the partially contracted postprandial gallbladder. The mucosa is visible. सांस निकाल दो. अब रोक लो इधर ही. There you see the mucosa of the gallbladder because it is contracted. There you see the portal vein entering. ले लो सांस आराम से आराम से. So we have seen the liver. You can appreciate the portal vein. You can see the hepatic veins there. And now I'm moving in the next intercostal space. Further next, further next. And now I have reached the kidney. I have seen the sweeping scan of the kidney. I have seen the psoas muscle behind. This is the psoas muscle on which the kidney is gliding, is sliding. हाँ जी, सांस लें बेटा, सांस लो, निकाल दो. So this is the psoas muscle, which is stationary and it is sliding over it. Lamba सांस. There you see the kidney sliding over it. I have seen through the intercostal spaces the liver, and now this very important place along the right costal margin in the epigastrium. And my probe is facing the right shoulder. I am facing the right shoulder. My fingers are above. You can see my hand is not touching, but slowly I will go like this. And then I will rise. So you see, in order to take a cross-sectional sweeping scan, if you find a patient very fatty and it becomes difficult for you to see the liver properly, I would then advise my trainees that if keeping your hand behind the probe becomes difficult, you can always place the probe like this. There. Press it. Now it is easy. And now slowly my hand will rise. सांस रोक लें इधर ही. And first I will see the hepatic veins, the right, the middle, and the left. There we are. And then I will see the so-called deer sign. The portal venous system is like a deer. There you see the neck of the deer, सांस रोक लें, the horns, the front leg, the hind leg. There you see the tail and the hind leg here. And there you see that the gallbladder is riding the deer. This is the deer. You can appreciate the deer now. The gallbladder is riding. The gallbladder, the deer, the tail, the hind leg, the front leg, the horn, like that. This is how you see the deer of the portal vein. This is the left portal vein. This is the right portal. The inferior vena cava is here. This one. So we are going to see the liver like this. Now I go down. Once again, from the right side, lamba सांस, hold it, रोक ले. There you see, I can see the dome here as I move facing upward, and then I rise and I see the liver in toto. I have seen the normal liver parenchyma. There is food in the stomach, but we will try to locate the pancreas. And there we are in 8 o'clock position. I can see the pancreas. लंबा सांस रोकें. This, my dear, is the pancreas. I can draw a line for you. This is the head of the pancreas, the body, and there you see the tail. The tail actually goes down, but we can't see it here because of food in the stomach. So this is it. The head is there, the body and the tail. This is how it goes. We'll see it again. लंबा सांस रोकना. There we are. And we can also see the main pancreatic duct in the center. There we are. So my dear, I am now in the epigastrium, where if there are any para-aortic lymph nodes, I will be able to see behind the pancreas, which I couldn't see. This is the aorta. This is inferior vena cava. This is aorta. I didn't see any para-aortic lymph nodes. Now I am looking upon the aorta and the mesenteric artery, superior mesenteric. I don't see any this is mesenteric artery. I have brought it down. There are no lymph nodes here. There are no lymph nodes here. You can see the vertebral body behind this one. And there you see the aorta dividing into right and left iliac trunks. And I'm going down after passing through the retroperitoneum, and I entered the bladder, where I can see the two ureteric orifices here and here, this one. I can put color here to see if a urinary jet comes out from any one of the ureteric orifices. I will be able to pick it up. So within 1.5 minutes, you will see a urinary jet coming out. In the meantime, we can see the seminal vesicle, the right and the left. Seminal vesicle behind the bladder going into the prostate. This is the prostate and the anal canal behind. This is it. There you see. This is a urinary jet, a strong one. There it is. The urinary jet from the left ureter. Wow. See, this is it. I'm rewinding it. Don't think that it is coming again and again. It came only once. So, my dear,